the jungles of West Africa to the cities.
Dead bodies 15, 16, 17, 18.
The inside story of how the Ebola virus spread.
It's pure craziness. It's like watching a zombie movie.
And the global failure to stop it.
The world has never faced anything like this. We've never prepared for it.
Ebola was not an exception. Ebola is a precedent.
Now we head to protests which have erupted in Kenya over plans to build an Ebola quarantine center for U.S. nationals on an Air Force base in the country's central region. According to news agency and eyewitness reports, at least 2 people were killed when police opened fire during the protests. Many locals working on the airbase.
They opened fire and killed 2 of the protesters, like the cops or military or whoever, I don't know.
Feared that they could be exposed to Ebola patients. A Kenyan court has suspended construction of the facility. President William Ruto is, however, defending the plan.
Straight to the White House, Dr. Mehmet Oz, the head of Medicare and Medicaid for the administration, actually holding the briefing today, talking about Ebola.
Precious to us. You have a golden hour in many of these instances around trauma, but for illnesses, it's also relatively short. So we are confident, and the State Department's working on this diligently, that they're going to be able to work out something with Kenya. There has already been a fair amount of communication around this issue. We have and that's why there's a UK base there. We have other people who might be willing to welcome us. So we have our German colleagues as well. So there's many places we can send folks, but sending them across the world, especially when we're not sure what's going on with them, is probably not the wisest.
All right, now to this. A court in Kenya has extended its block on a proposed U.S. Ebola quarantine facility after protests against it turned deadly. Hundreds of people took to the streets yesterday.
The World Health Organization said the fight against Ebola in the Democratic Republic of the Congo is, quote, catching up with the spread of the virus. But health officials warn the crisis is far from over. More than 340 cases have been confirmed, and the outbreak has crossed into neighboring Uganda, worsening the challenge of containing the deadly disease in a region already riddled with conflict.
The World Health Organization's top doctor is in the Ebola hot zone.
Looking forward to stop this Ebola with the community.
The Director General of the WHO touching down in the Democratic Republic of Congo over the weekend.
The key is to come forward as early as possible.
This outbreak, already the 3rd largest in history, as the international response ramps up, doctors on the ground racing to play.
ఎబోలా వైరస్ కేసులు కలకలం సృష్టిస్తున్నాయి. ఎబోలా లక్షణాలతో మరో 2 వ్యక్తులు సికింద్రాబాద్ గాంధీ ఆసుపత్రిలో చేరారు. దీంతో ఇప్పటి వరకు ఈ వైరస్ లక్షణాలతో గాంధీలోని ఐసోలేషన్ వార్డుకు చేరిన వారి సంఖ్య 3కు చేరుకుంది.
I don't know what language that is, but I understand what she's saying, okay? This is going to be a problem.
We're just weeks away from the largest and most expensive World Cup in history. 6.5 million tourists are expected across 3 host countries over 39 days, and a record 48 countries are participating too. But an event this big faces several health risks, and recent deadly outbreaks of Ebola and the hantavirus have gotten a lot of people worried that a major health crisis is on the way. Public trust in U.S. government health agencies like the CDC is already at historic lows.
The public trust? I wonder why.
It also exited the U.S. from the World Health Organization. Despite this, Ebola and hantavirus risks are low.
There are so many locks in place from a public health infrastructure that has been built over years and from lessons learned between 2014 with COVID and now, especially with new policies and emerging technologies, that it is not a public health threat.
For one, Ebola spreads through direct contact with the blood or body fluids of an infected person. So far, outbreaks are contained to the Democratic Republic of the Congo, Uganda, and South Sudan. The U.S. government imposed travel restrictions against these countries and upped public health screenings for visitors in May.
Things that we take for granted, such as our public health and hospital systems, state-of-the-art medical care, easy access and constant access to running water and personal protective equipment, allows us to have a lot of confidence that any case that potentially were to arise here or even have a concern of Ebola would be able to be easily contained and managed in isolation.
Are y'all going to go to the World Cup? I don't think so. Are you even going to watch it? I mean, I definitely am not. Y'all have fun with
The
that.
State Department today strongly urged Americans to avoid traveling to 3 Central African countries, the Democratic Republic of Congo, Uganda, and South Sudan, citing the Ebola outbreak there. More than 130 people have already died. Hundreds of others are believed to be infected.
What happens when a virus starts moving faster than the Air Force to stop it? Well, right now, that's exactly what's happening with the Ebola outbreak in Central Africa. The World Health Organization says the outbreak in the Democratic Republic of Congo is becoming a serious emergency again, and health workers are struggling to keep up. So why is this outbreak so hard to control? First, there's an issue around trust. Misinformation
Around trust, I wonder why.
is making many affected communities suspicious of
That
health
looks
workers and
familiar.
efforts to stop the virus. Some
That
feminists
looks
think the
familiar.
virus isn't real, while others are afraid to report cases or follow